Osteoporosis is a medical condition characterized by weakened bones that are more susceptible to fractures. The term comes from the Greek words osteo, bone, and porosis, porous, which together refer to the thinning of bone tissue. Osteoporosis is often referred to as a silent disease because it progresses without obvious symptoms until a fracture occurs. Common signs that can indicate the presence of osteoporosis, particularly in advanced stages, include bone fractures, especially in the hip, spine, or wrist, that occur with minimal or no trauma, back pain caused by fractured or collapsed vertebrae, loss of height over time, stooped posture or a hunched back, and decreased mobility due to bone pain or fractures. However, many people with osteoporosis may not show symptoms until they experience a fracture. Osteoporosis occurs when the body either loses too much bone, doesn't make enough bone, or both. There are several factors that can contribute to the development of osteoporosis: age, as bone mass naturally decreases with age, particularly after the age of 30, gender, as women are at a higher risk, especially after menopause when estrogen levels decrease, leading to bone loss; genetics, as family history of osteoporosis or bone fractures can increase risk; hormonal imbalances, as low levels of estrogen in women and low levels of testosterone in men can increase the risk of bone loss. Nutritional deficiencies, as lack of calcium and vitamin D can impair bone formation; inactivity, as lack of weight-bearing exercise can lead to bone weakening; medications, as long-term use of corticosteroids or other medications can increase the risk of osteoporosis; chronic diseases, as conditions such as rheumatoid arthritis, hyperthyroidism, and certain gastrointestinal diseases can contribute to osteoporosis; and lifestyle factors, as smoking, excessive alcohol consumption, and a diet low in calcium and vitamin D can increase the risk of developing osteoporosis. Osteoporosis is usually diagnosed with a combination of medical history, physical examination, and diagnostic tests, particularly a bone mineral density (BMD) test, with the most common method being a dual-energy X-ray absorptiometry (DEXA) scan, which measures bone density in areas like the spine and hip. A T-score of -2.5 or lower indicates osteoporosis. Fracture risk assessment, using the FRAX tool, is often used to estimate the 10-year risk of bone fractures based on factors like age, gender, bone mineral density, and lifestyle. Blood and urine tests may be done to assess levels of calcium, vitamin D, and other markers of bone metabolism. The goal of osteoporosis treatment is to reduce the risk of fractures and maintain bone health. Treatment options include medications such as bisphosphonates, which are commonly prescribed to slow down bone loss; denosumab, a monoclonal antibody that inhibits bone resorption; selective estrogen receptor modulators, SERMs, which mimic estrogen to help maintain bone density; hormone replacement therapy, HRT, which may be used in postmenopausal women to increase estrogen levels and prevent bone loss; teriparatide, a form of parathyroid hormone that stimulates bone growth; and romosozumab, a newer medication that helps build bone and reduce fracture risk. Calcium and vitamin D supplements are essential for bone strength, as calcium is crucial for bone health and vitamin D helps the body absorb calcium effectively. Lifestyle modifications include exercise, as weight-bearing and resistance exercises can help strengthen bones; fall prevention measures to prevent falls, as fractures in people with osteoporosis can occur from even minor falls; and nutrition, as eating a diet rich in calcium and vitamin D is critical for maintaining bone health. Physical therapy can help restore strength, balance, and mobility for individuals with fractures or severe bone loss. Preventing osteoporosis involves promoting bone health throughout life. Key strategies include maintaining a healthy diet to ensure adequate intake of calcium and vitamin D, exercising regularly with weight-bearing exercises and strength training, avoiding smoking and excessive alcohol, monitoring bone health with regular bone density tests, and fall-proofing your environment by reducing fall risk and ensuring good balance and muscle strength through exercise. Osteoporosis is a condition that leads to weakened bones and an increased risk of fractures. Its symptoms may not appear until a fracture occurs. Common causes include age, gender, genetic factors, poor nutrition, and certain medications. Diagnosis is confirmed through bone density testing, and treatment includes medications, supplementation, and lifestyle changes. Preventing osteoporosis involves maintaining a healthy diet, regular exercise, and minimizing fall risks. Early detection and proper management can significantly reduce the risk of fractures and improve quality of life for those affected by the condition.